Next, from Carbondale, Illinois, our one-on-one conversation with Karen Freitag, Executive Director of Southern Illinois Regional Social Services. We hear of the efforts to treat mental illness and drug addiction and the effect of the state's fiscal crisis on those efforts. This runs about 20 minutes. Karen Freitag with Southern Illinois Regional Social Services. Thanks for joining us on the Illinois Channel.
Thanks for having me.
Let's begin. First of all, what is it that you do here at the Southern Illinois Regional Social Services?
Well, in a broad sense, we do mental health, substance abuse, and youth and family services. There are a lot of specifics within those services, but those are our main categories.
And how many, what size of a region or territory do you service?
Predominantly Jackson and Perry counties, but we do bring in people from surrounding counties as well. We may serve from Union and others.
And for those people who are watching this in the Chicago region, where are those counties?
They're in pretty far south Illinois, in between the rivers, probably an hour from Cape Girardeau and Paducah, so close to Kentucky and Missouri.
And you're headquartered right here in Carbondale.
Yes, we are.
When you, the predominant issue that you're trying to deal with is what?
It's funding predominantly. We have lost a lot of funding over the past 3 years, and the impact has been less services to people in this area. And if people don't get the mental health, substance abuse, and family services that they need, then things happen in their lives that sometimes cause bigger problems. They may end up in emergency rooms with a crisis, or they could end up in jail.
When you are dealing with, how do you call them patients or clients?
Clients, they're people first.
And how do your clients come to you? Are they, and is it an inpatient or outpatient treatment?
We are all outpatient, but we do have some residential services. We have 24-hour care for some youth who are coming out of DCFS with a mental illness and need a little bit more care before they go into the adult room.
And again, a lot of people don't know these acronyms. DCFS is?
The Department of Children and Family Services.
So these might be, or do you get children maybe who have also been in foster care?
Yes, they have been in some kind of care all of their lives, and most recently a very structured group home type situation, because they have needed a lot of structure in order to be able to conduct their lives.
You know, I think a lot of us, fortunately, have come from strong families, and so our ideas of what mental health problems are is maybe when we were feeling the blues. And
right.
I think a lot of us don't really appreciate maybe what are some of the specific kind of circumstances of the clients that you're dealing with. Delve into what is the background that your clients have come from, and I know it's going to be a variety of things, but tell us about some of that, and maybe we can get a better insight into some of the issues that you're trying to cure.
Well, like you say, it is varied because people from all walks can have a mental illness or a substance use disorder. We have dealt predominantly with people with very few resources and with the most difficult problems. For example, we are dealing in children with serious emotional disorders and in adults with serious and persistent mental illnesses. These are those that tend to have been longer lasting and affect people's lives more severely. It may be depression, but it's going to be major depression as opposed to something that just lasts a few weeks and is mild. So
we're here in the Carbondale area, and in fact looking at some of the issues there in life in Southern Illinois, although it seems as I'm listening that a lot of what you're dealing with are really probably the same issues that mental health professionals would be dealing with anywhere in the state.
True.
There might be some specific causes. To what extent we tend to hear from law enforcement that methamphetamine is more of a problem in Southern Illinois than in Northern Illinois. How much do you run into clients who are addicted to methamphetamine, first of all?
We certainly do, and it has been more of a problem in Southern Illinois. But law enforcement and organizations such as SIRS have dealt fairly effectively with it. So in substance use, the drug of choice tends to change according to how well law enforcement is clamping down and treatment and things like that. So opiates and abuse of prescription drugs is becoming a bigger issue. Heroin's becoming a bigger issue right now. So
On the treatment side, and when you get into things as we're talking about methamphetamine and heroin, that almost, is that a mental health issue? Is that is that classified? What do we mean? Maybe we ought to start. What do we mean? When we say mental health issues? What are some of those issues that we classify as mental health issues?
well, it would be disorders that are classified in it's the Diagnostic Statistic Manual, and it's things like depression, bipolar disorder, schizophrenia, things like that. A substance use disorder is not necessarily considered a mental illness, but a lot of times they're co-occurring. And for example, somebody with schizophrenia may self-medicate and then they develop an addiction. So they sort of go hand in hand at times, but not necessarily so.
And what success do you have in treating those with substance abuse?
Pretty good success. We have an excellent small but mighty team of counselors who work with people individually and in groups and try to keep really current with whatever drugs and alcohol are happening right now. And I can't remember the percentage right now, but
you have a fairly good turnout.
Yeah.
And once, is there much relapse of those clients? Or?
With substance use disorders, there's a lot of relapse, and it may take several tries before somebody ultimately clicks in and gets where they want to go. Addiction is really, really difficult.
Given the state is struggling as it is financially, and we brushed up against this topic earlier, but I wanted to go back to it. What would you say to those that would say, right now is not the time for the state to be spending more money on anything? And secondly, that when we deal with issues of mental health, I think there's a presumption that it's difficult to know if somebody really has mental health or just depressed, and they should suck it up, frankly. And if we can see a broken arm, we can see a broken leg, we know you send them to the hospital to treat those things. We can see the results of it being treated. Is there? Well, before I go off too much, what would you say to those that bring up those kind of issues that I think they fear from a financial standpoint that trying to make mental health coverage equal to treating physical ailments is a black hole into which we would just pour any amount of resources and maybe not have tangible results?
Right, and the research has shown that it's not going to cost that much more when you're talking about parity between mental health and physical health issues. And I would contend that if you do not spend the money on mental health and substance use issues in the treatment arena, and even in the prevention area, you're going to spend it in law enforcement and institutions, which are very much more expensive than treatment is. It's really, really efficient and effective to use our tax dollars on intervention and service.
Do you turn people away on the funding issue? Are you able to treat everyone? How does that?
No, we are not anymore. We used to come close to treating everyone, but the amount of money that has been reduced has changed that. And what the state of Illinois has done, which is kind of similar to what a lot of states have done, is put their eggs in the Medicaid basket. So because they can get a federal match for Medicaid, they have changed the rules so that there's something called medical necessity, and we can provide service for that or treatment for that. And they've cut the amount of state dollars going into services. So people who are not Medicaid eligible can only get a very, very limited service. They may have the same needs as somebody on Medicaid, but they cannot get the services, and we can't provide it because we're not funded to do it. Now, if they have insurance, there are options, but they're limited, particularly for people with a serious mental illness who need a wide range of services and a lot of support in the community. Insurance doesn't necessarily cover that, so only something like Medicaid would, and state dollars used to. They don't anymore.
How has your own budget fared over the last several years? We
have lost $1 million, which is probably about 15%. So we have gone down dramatically. We've had to cut employees and really push those that are left here. They're working really hard.
And you just had your 50th anniversary of the organization.
Yes.
What successes would you point to, or how would you quantify what good you've done within the community that would be an argument for further funding?
Well, I think the success comes in the people. We've had successes in every arena with youth and adults and people who need just to live in their own homes in the community. We can point to success. Keeping a kid out of jail and in school, for example, that child becomes a productive citizen. That's a huge success. We've had people with very serious illnesses. After working with them for a while, they are living in their own homes and may even go back to work. There are plenty of stories about people that we can point to, and I think that's the main issue. We're in the people business.
I wanted to ask a question. I'm not sure if it's fair or not, but to what extent are mental health issues environmentally caused, or is there a biological basis for mental health issues as well?
Yes, there are biological issues and there are environmental issues. Some people genetically have a predisposition to have a mental illness, and it may be within the family, or it may be something that happens just within that person.
So depression, as an example, might run within a family?
Yes, it could very well. But there are also environmental things. A trauma could cause a mental illness. It could develop into something. For sure, it could be a post-traumatic stress disorder, but then untreated trauma can develop into something much more serious.
It's interesting you say the post-traumatic stress, and of course that could be anything. That could be after a car accident or something, or a working accident. But do you reminded me of veterans. Do you deal with veterans, or is that does the VA treat them?
We may if they come to us, but the VA in this area is actually beefing up their services, and they're adding to their behavioral health services and going to attempt to serve predominantly everybody in that area.
When you treat some of the children who have perhaps been abused, or maybe they've not been physically abused, maybe they've had just a lack of love, how do you treat them, and again, with what success?
There are a variety of ways, but I'll give you a couple of examples. One is mentoring. We have a Big Brothers Big Sisters program, so we match a child with a caring adult who has been thoroughly screened, and that adult is a friend to that child for a minimum of a year. And the statistics show that that makes a huge difference in that child's life. They do better in school and do better in their relationships and things like that. So that's not necessarily treatment, but it's prevention, and it does make a big difference in that child's life. Another example is we've got groups that are called SPARK groups, and they are a trauma type of treatment, and they work with kids around dealing with stress. And it is a 16-week program where these kids are taken through a process to be able to become more resilient, to deal with those stress issues and trauma issues, and it's shown a great deal of success. So that's two different kinds of things, a prevention issue and a group issue. And then we can work with individual counseling and or a variety of things. And we do prevention in the schools.
And how do you do it in the schools?
We go into classrooms and we used an evidence-based curriculum that takes them through some skill building types of things, just in general, and then we have a different focus that focuses on substance abuse prevention. So we are in schools in a couple of different ways, working with kids of different ages.
You know, going back to that variation between treating a physical problem as compared to a mental, to what degree can you treat a mental illness and perhaps are treating it through prescription drugs?
A lot of times the drugs can be used alone, but the best treatment is typically use of a drug in conjunction with some sort of therapy, like cognitive behavioral therapy, in addition to the drugs, has better results.
And so if you have someone, well, I mean, if someone is depressed, maybe it's a chemical imbalance in the brain that can be treated, and you find that there's some success with that then?
Yes. And often a person may have lost some skills in that depression, and they need some therapy to help with their thinking patterns and behaviors, to change some behaviors and some thinking so that they get better.
Before we close out, there's always been, unfortunately, a stigma about mental health. What would you say, and you know, as you know, I mean, as we say, it hits all classes of people.
Right.
We have some families that we hear in the news where one of the parents will go off and have a murder-suicide and maybe even kill their kids under the stress, maybe of losing a job. For anyone who's under undue stress, or maybe knows of someone who's just been suffering from a depression for a long time, what is your recommendation as far as them getting treatment?
I recommend that they encourage treatment and also be a friend at the same time. It takes both. People with mental health issues need friends, and then they need to be encouraged to go to treatment.
And what about the person themselves who might be just suffering a great deal of stress? To whom do they contact, or is there a clearinghouse? I mean, of course, this would be seen across the state. How do they even find out what services are available?
Well, there are, for most people, there are websites, and you could probably start there. For somebody who's just looking for a few tips, you could start there, but there's usually something locally where they can go. You can start with your primary care physician and get some tips there on where to go. All
right, very good. Well, Karen Freitag, I'm sure we could talk a little longer, but we appreciate you taking the time to meet with us on the Illinois Channel.
Well, thank you so much. I enjoyed it.
Thanks.
Thanks.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.